So through the decades in medicine, in the world, there have been so many diseases and infections that once you find the cure, then all this misinformation goes away. And so, for example, there was leprosy. There was a time when people really were not knowledgeable about cancer. They would whisper that the person has cancer. And now we've come, full circle where most of the cancers actually are treatable, which is wonderful. So these are the advances of medicine. And then we had the same issue with HIV, and now we're dealing with Ebola. So about 20, 25 years ago, when HIV infections first came onto the horizon in a big way, there was a lot of misinformation. There were concerns that if you had a patient with HIV next to a patient who did not have HIV, somehow you'll catch the infection. And that was not the case. There were schools that they were, where they felt that if there was a child who was HIV positive in the classroom, they were being really discriminated against. And that was really unfortunate. Again, it was misinformation about how some of these infections get passed on. Oftentimes when things happen in life, whether it's an infection or whether it's a disaster of some sort, we all react to it, both grown-ups and children, and that's completely all right. This is just a normal reaction, normal human reaction to an unfortunate incident or unfortunate event. Sometimes children don't appreciate how some of these infections get passed on, and so I think it's really important to give them the facts. So, for example, if you have a cold, you can catch a cold if you're around other kids. I know so many preschoolers, the mere fact that you're in daycare, you tend to get more colds. On the other hand, there are infections that are really actually not that easy to be passed on. And you have to be in you need to be in contact with either, their body fluids and things like that. And it's hard. So while it's a very serious infection, it is really not that common. And I think we just need to give them the facts. Anytime anything scary happens in our lives, there's a lot of information that gets disseminated. And I think it's really, really important that we get our facts from reliable sources. So this would be from a medical source or someone in a position of authority, whether it's the health department or whether it's someone who is an eminent researcher or a clinician who has really worked very closely with any particular condition, that the facts and the information comes from that person. Because oftentimes there's just a lot of flurry of activity and lots of information that is being that comes across, and a lot of it actually is it's sensational, which can do more harm than it does good.